In my clinical practice, I often come across patients and physicians who are unable to say the difference between temporal lobe seizures and absence seizures. If a patient presents with spacing out episodes, regardless of age, many of these patients are labeled as absence seizures. It is important to know the difference because it helps you decide the best effective treatment for these patients. I will start with giving you a brief overview about the difference between generalized seizures and focal seizures. So I'm drawing across a coronal section of the brain. And once we have this figure here, I will discuss the difference between the focal seizures and generalized seizures. So now I am not the greatest artist, but let's say that this is a coronal section of the brain. I'll draw the gray matter here. So we have the gray matter that is here. Okay. So let's first talk about the difference between focal seizures and generalized seizures. So focal seizures, let's say there is an area of focus here that's generating the seizures. The seizures will tend to spread to areas around this area, and the seizures may be confined to this area here. These may spread to the contralateral temporal lobe or may spread to the other areas of the brain. These are focal seizures, which were previously called partial seizures. In patients who have generalized seizures, the seizures involve both hemispheres more or less simultaneously. So both these areas here, the spread is symmetrical over here. Generalized does not mean that each and every part of the brain is involved. It just means that the two areas, two sides of the brain get simultaneously involved without a focal onset. So with green lines I've shown you a generalized seizure, with red color I've shown you a focal seizure. Now if the focal seizure stays here and a person does not lose consciousness or awareness, you call it a simple partial seizure. If it involves the other side of the temporal lobe, and now you have the two temporal lobes involved with loss of awareness or consciousness, you call it a complex partial seizure. And if the seizure spread to different areas of the brain with resulting tonic-clonic activity, you may call it a secondarily generalized tonic-clonic seizure. So there's a difference between generalized seizures and the focal seizures. So I'll write down the classification here quickly. So you have seizures that can be classified as focal and generalized. Focal seizures can be further classified as to simple partial seizures, where patients don't lose consciousness or awareness. Seizures are restricted to a focal area. Complex partial seizures, where patients do lose awareness. And secondary generalized seizures, where it starts from a focal point and then involves different parts of the brain. Whereas patients With generalized seizures, these can be divided into convulsive, such as generalized tonic-clonic seizures, and non-convulsive, such as absence seizures. So with this understanding, let's move on, and I will give you a number of points to help differentiate the different types of seizures. So let's say these are temporal lobe seizures here, temporal lobe seizures, and we have absence seizures here. Absence seizures. So in terms of duration, temporal lobe seizures typically last from 30 to 60 seconds, whereas patients with absence seizures, these typically last 5 to 10 seconds. The age of onset can be any age. These are typically seen in absence seizures 5 to 10 years of age. There is postictally, meaning after the seizure, there can be confusion and disorientation with temporal lobe seizures. With absence seizures, there is minimal or no postictal state. If you look at the MRI, you may find focal abnormalities, may or may not find focal abnormalities. Here, with absence seizures, it is normal. If you look at the EEG, you see focal changes. Focal changes. Here you see, with absence seizures, you see generalized changes. Automatisms, which are sort of repetitive lip smacking or repetitive ringing movements of the arms or hands, are often seen with temporal lobe seizures, not seen with absence seizures, or extremely infrequent. Aura. So patients with temporal lobe seizures may experience deja vu, they may have an olfactory aura, they may have an abnormal taste, whereas absence seizures do not have no auras. So that will help you differentiate the different types, the temporal lobe seizures versus absence seizures. The difference is extremely important because if patients with absence seizures are given Tegretol, which is a medication used to treat temporal lobe seizures, the absence seizures can actually get worse. This is an example. This is an EEG which shows a temporal lobe seizure. So you see on the right side, this rhythmic activity right here, this is a temporal lobe seizure on the EEG, and here you have an absence seizure which shows a 3 per second spike and wave discharge. So this is a typical pattern called 3 per second spike and wave discharge, which is typical of absence seizures. So the next time, if you are a patient and if you're given a diagnosis of absence seizures, you may want to discuss with your physician the difference between temporal lobe seizures and absence seizures. That's for it today. Thank you.